In my clinics, the one thing we most often see is, we most often hear is, I went to my doctor, I said I had pain, they told me I had to stop working out. They told me I had to stop running. They told me I had to stop exercising. Hearing these words is devastating for many people. It is a way of life for most of us. Having that release and being able to get out and being able to work out is part of who we are. So hearing someone tell you that you are unable to work out is something that can be devastating. Most often things that we hear are, I went to my doctor, I went to my healthcare professional, I was hoping for answers, they told me to stop running. I don't necessarily feel any different, the pain has gone away, but I'm not doing what I love. Or we hear, I took 2, 4, 6 weeks, whatever it is off, and the pain's still there, and it's not going away. Or I took a couple weeks off, the pain was gone for a little bit, but now it's back even more. I went for a run, and now my knee pain's back. Or, you know, I had a little discomfort, and I was running through it, and all of a sudden I get to the race, and I have to stop in the middle of the race because my knee hurts so bad. There are so many of these stories that we hear so many times in my clinic. When people get tired and people get frustrated with the answers, they stop trying to find help because they don't want to hear the answers. And I've been told many times as people come in, they say, if you tell me I can't work out, I'm going to leave. There won't even be anything further. If you tell me what everybody else has said, I'm going to leave. Many people that we treat have tried, you know, everything, drugs, injections, you know, some even go as far as, you know, surgery, and some people, you know, try other PTs and things like that, and, you know, and they say nothing helps, and, you know, the doctor gave me an injection, that didn't help. I went and I did a couple exercises, and that didn't help. I went and I tried to figure this out on my own. I did some online research, that didn't help. I took some time off, that didn't help. I changed my shoes, that didn't help. Everything helped for a little bit, but nothing lasts. We hear this constantly here. And what we are here, and what this video is going to show you, is some of the 4 main causes of this pain. Most of the time it's knee pain, because that is the hub of all the activity that goes on in the leg. So we see a lot of people who have been told to stop running because it's bad for your joints, it's hard on your knees, you have this knee pain. Nobody can diagnose it. This is a lot of difficulty for people to have this undescript knee pain, because most of the times x-rays are negative, MRIs are negative. So you wind up with this pain. The knee is just a hub for all the activity that goes on in your lower leg, in your entire leg, excuse me. So what happens is, here's your leg, here's your kneecap, and then here's your lower leg. So when you're dealing with this undescript knee pain, and you're dealing with pain that has allowed you to stop running, and it could be knee, hip, back pain, whatever, but you've gone and you have run the ends of the earth, and you have no one telling you that you can continue to work out, and every time you do work out, the pain is so great, or it's become so great, that you can no longer do it. What happens is there are muscles that are down here. Okay, so you have your shins, you have your calf, you have your gastroc located down here. You also have all the muscles that are in the foot that come up and attach here also. So everything going on down here at the hip, at the foot and the lower leg is coming up and it's attaching at the knee joint. Same thing up here in the upper leg. All of these muscles are coming down and they are attaching over, some of them cross over the knee joint. So what's happening is you have everything down here coming up, kind of landing right here, and you have everything coming down right here and landing right here. Nothing is specifically occurring at the knee joint itself, but actions that you're taking at your hip and actions that you're taking at your foot are affecting the knee joint. There are some times that knee and hip pain are truly able to be diagnosed. If you have a tear of your ACL, if you have a tear of your PCL, a meniscal tear, a labral tear in your hip, if you have some ligament damage, those are things caused by traumatic injury generally, meaning you know exactly what happened. You fell and you have this pain. You cut wrong when you were running and you felt a pop and you had this pain. You fell down the steps. You sprained your ankle. Those are traumatic injuries. Those you understand what happened and why you have pain. The pain we're talking about today is the pain that you look at and you say, I don't know where this came from. I have no idea. I thought I was healthy. All of a sudden, I have this pain that no one can tell me about. It keeps getting worse. It came on suddenly. These are the types of things that I'm describing. The traumatic pain that occurs from a fall or whatever, those types of instances where you can literally put your finger on what happened, those are not the type of pain that we're talking about. Those you know what happened. Those you understand. Those can happen at the knee joint. I'm talking about everything else. And when we're not talking about the knee, the hip's the same way. Everything comes up from here, okay? Everything attaches from the back and from the knee up at the hip. So I call the knee the hub. There's nothing that's going on right at the knee joint that's causing you this pain. It's manifesting itself at the knee joint because this is kind of the perfect storm right there. It's got the hip and it's got the lower leg coming down and going up, and it meets right there at the knee. So shortening of muscles, changing of muscles, the way muscles react, those will affect the knee. It'll pull on some bones, it'll make some, it'll just change how that joint is able to act. That will cause the knee pain. There is nothing, and I repeat, there's nothing that will be treated at the knee to make the knee feel better. So many of you have tried braces, and you have tried tape, and you have tried all these different things specifically at the knee. You've neglected the hip, you've neglected the foot, you've neglected the calf, you neglected the back. All anybody does is hear knee pain, and they look at your knee. That's what we do. Knee pain, you must have knee pain, so it has to be coming from your knee. Not true. The type of pain that I'm talking about where people say, we don't even have an idea what's going on, you need to stop working out. That's it. Every time you run, you get pain, so stop running. We know what that pain is, and we can diagnose it, and we can get it out. We just need, to understand a little bit more about you. But that type of pain is something that, while it's presenting as knee pain, is not coming from the knee. And today I'm going to go through 4 main causes of this knee pain that we generally see in my clinic. So the first one is IT band syndrome. And some of you may have heard of this before. This is kind of a more popular one. Now, the difficulty with IT band syndrome, and what the IT band is it's a tough fibrous band. So here's the upper part of your leg. This is the thigh. And this is the inside of your leg. Okay? So on the outside runs the IT band. Okay? And it runs from the hip all the way down to the knee, and it crosses over the knee. Most time, if you have pure IT band syndrome, you are going to have problems going up and down the steps. That is one of the main things that is reported as painful. Anywhere where your knee bends slightly and straightens, so when your knee is in about this position, and then it goes to straight, it'll cross over that IT band and it will irritate it. So it's just a very short bend. It's like riding a bike. Cyclists get this a lot because of that constant rubbing on the IT band. This will present as pain on the outside of your knee, right where it attaches on the outside of that knee joint. And it will be very painful doing running, cycling, anything, steps. Other than that, walking won't bother it, swimming, anything along those lines. However, most often we don't see this alone. Most often people have ignored this and have allowed other issues to come into play while they're trying to compensate for this. So while this sometimes may be an issue, you may also feel pain in the back of your knee, in the front of your knee. And we need to address all of the factors going on. But this is generally one of the main causes that we see knee pain going on in people who work out, and it goes undiagnosed. The second reason that we see pain in the leg, in the knee most often is because of back pain or leg length discrepancy most often. So here we have, back pain. So again, you have your pelvis here, and you have these muscles that come down and they're attaching all over the pelvis, and then you have your hip joint, and they're coming out and they're attaching onto the hip joint, okay, and then down here you have your knee. So when you have back pain, and we see this especially in mothers who just started getting back into running, or even mothers who've had kids for 10 years but have just started getting back into running. This is a common symptom of having that back pain affect the knee pain. So what will happen is these muscles back here and back here will all be affected, and those will cause a pull on the hip. All right? So what happens is the hip and all muscles around the hip have to respond to make up for the shortening that's going on there. So they'll get shorter, the muscles down here will start to get shorter, and so on and so forth, and you have a snowball. Generally what this winds up happening is it makes one leg shorter than the other. And really there's no way to tell that unless you get measured. But what will happen is going down curbs will be very painful. Going down steps and leaning on that leg will be very painful. Those are the typical types of symptoms we see when the knee pain is coming from the back. Again, you may not have any symptoms at the back. You may not feel anything. Normally when I start taking a history and I ask people, do you feel something in your knee? Did you feel something in your back? Well, I did. Now that you say that, or now that you ask that, I remember, yes, I did have some pain in my back and in my hip, but I ignored it, I let it go, it went away. Let me take this time to tell you that pain never goes away. Pain never disappears. You don't wake up with a stiff back one day and all of a sudden it's gone. What you have done is you have compensated for it. So you have taken that pain that you have felt and you have compensated for it in order for it to go away. Sometimes that simple compensation will make it go away for good. But if this pain keeps reoccurring over and over, and you wake up with back pain every single morning, and you just say, by 2 or 3 in the afternoon I'm good, or I'll just take a hot shower and I'm good, there is an underlying dysfunction there that needs to be treated. It's not going away. You're developing compensation patterns. You're developing ways to trick your body into thinking it's not in pain. So what happens is these muscles take care of themselves in your back, and they start by shortening, changing the way they're working to stop that pain. Your body is extremely intelligent. It will do whatever it takes to stop that pain. So it will stop the pain, and it will allow the pain to stop at your back. Without realizing it, you're now affecting your hip. Now the effect on the hip will then go down and affect the knee, and so on and so forth. So if you keep having pain and it goes away, you are not getting rid of it. You are simply compensating for it. And this is what happens when people take time off of running, or they take time off of their sport, and they come back and they're like, wow, I feel great. That's right, time off is all I needed. But then 6 weeks later, 2 months later, that pain comes back, and sometimes with a vengeance, because you didn't treat the problem. You took time off, you stopped. And again, if it's not a traumatic injury, stopping's not going to do anything for you. You haven't treated anything. You need to make sure that you get to the root of the problem. You figure out why you have that pain in the first place. Sure, you take a couple of days off and you go back to running, the pain's going to have subsided. You've stopped the inflammation. But unless you stop the problem, that inflammation is going to come right back the minute you start running again. So this is the second reason that we have for back pain, is back pain. That can be referred down to the hip and to the knee. And then the third most common reason that we see pain that takes people out of their sport or gets them told never to run or do activities again is muscle imbalances. So for muscle imbalances, you have 4 main groups of muscles, and that way oversimplifies it. we're not looking to get into in-depth information in here. So what happens is you have these four, so you have the muscles on the outside, on the inside, on the front, and then on the back of the leg. All four of these have to be pulling in unison in order for the leg to function properly. Now, most of you, if you don't take the time to do strength training, are going to develop some of these more than others. Most people that come in who have knee pain are quad dominant. Quads are the muscles in the front of the leg, so up here. Those are going to be a little bit stronger. And the muscles in the back of the leg, the hamstrings, are much weaker. So we see this, what should be a yin and a yang relationship, we see the yang really pulling much more, putting a lot more pressure on the knee. This most often will present as knee pain in the front of the knee. Squatting, bending down, kneeling, you're going to get that pain. And you know, it's not arthritis, you had your x-ray, everything looks good, but you still have this nagging front knee pain. It's because of muscle imbalances, and it's because usually it's between the quadricep and the hamstring. It can also be in between the IT band and the muscles of the inner leg. We get a lot of groin strains. Those are results of these muscle imbalances. Some groin pain or just pain on the inside of the knee can be caused from having that muscle imbalance from the front to the side. And a lot of times it happens in more than one avenue. So we'll see muscle imbalances, we'll see the quad pulling harder, and we'll see the IT band pulling harder. So we have to work on the other two muscle groups simultaneously to get them to pull back. But muscle imbalances will cause you tremendous amounts of pain at your knee. Most people do not experience any pain in the muscle themselves. You will not feel any hamstring pain. You will not feel any quad pain. Like I said, you may feel a groin strain. That's in a very evolved case. But most of the time you don't feel anything except this knee pain. And everyone looks at you like you're crazy because you have this knee pain that can't be diagnosed, that doesn't show up on an x-ray. And that's one of the causes, is muscle imbalances. They won't show up on MRIs. It won't show up on an x-ray. There's nothing that will detect that. So one of the causes of this undiagnosed or this knee pain that will take you out of the game could be a muscle imbalance. And the final reason for knee pain, or reasons that you're told not to work out anymore, are trigger points. And trigger points are just a fancy way of saying knots. Knots are something that can very seriously affect your running or your workout position. Why does it not affect you so badly? Usually there's not one. There is a whole host of them. And with knee pain, it's usually a snowball issue. And what I mean by that is there is usually something that happens, a compensation pattern that happens, and it winds up becoming a muscle that was compensated for, and then another muscle that compensated for that, and another muscle that compensated for that, and so on and so forth. So we wind up with these large compensation patterns that wind up affecting the knee. So for muscle imbalances, generally your muscle is this long. So when you get a trigger point, it'll come right in there. So what happens is all the muscle fibers around there start going towards this trigger point. It starts kind of gathering friends. So then your muscle becomes this long. But what you're doing is you're still trying to make it work at this length. But it's only working at this length. So it's got to find the length somewhere. So it's going to go to one of its friends next to it and say, help me out. So this one might get a little bit longer. So it makes up for that piece that it's missing. But then this one's working at too long of a length. So then it's going to go to its next friend, and it's going to start to pull, and that friend's going to start to get shorter to make up the length of the other one. So that's a very oversimplified explanation. But what happens is these muscles just start compensating and compensating, and you don't know that you're doing it. And this is the hardest part for people to understand. This is why you wake up one day and all of a sudden you have knee pain, and you didn't fall, and you don't understand, and you're running or you're working out, and you say, I have knee pain, and I don't get it. This is why. It didn't come there overnight. It's taken years sometimes to get there. Because this compensation led to this compensation, led to this compensation. And now your entire leg, from your quads, your hamstrings, your IT band, your groin, your calf, all of it is now riddled with these trigger points. And you've got muscles functioning at different lengths. Now some people, once I bring this up to them, I say, you know, you've made compensations, even if you're not realizing it. You know, you've changed the way your foot hits the ground. You've changed the way your hip rotates. And some people will say, you know what, I did notice that. I kind of ignored it. I didn't think it was anything. Don't ignore those signs. If you think that something is off, it is off. Your body will change things on you without you realizing it, just so the pain will stop. Nobody's body wants to feel pain. That's the main thing it tries to get rid of. Compensation patterns, it doesn't understand. It understands pain. Pain sends signals to the brain. It will do everything to stop that pain. So you can be walking around developing these trigger points for years and years and years and not feel anything until one day all of a sudden that knee hurts because you've got top-down, bottom-up problems, and it's all coming to a head right at the knee. So just to recap, some of the 4 main causes of knee and hip pain that can take you out of the game or get told you're not allowed to run or work out anymore are your IT band syndrome, which is just the pain on the outside of the leg, and you most often feel that when you're cycling or you're going up and down steps. Just bending and straightening that knee just a little bit, that'll get it fired up. Generally the pain is on the outside. If you catch it quick enough, if you allow it to snowball, the pain can also go onto the back of the knee or the other side of the knee or even the front. Now we have a leg length discrepancy caused by back pain. So that back pain with the weak core and not being able to have your hips stabilized very well will cause this shorter leg. You'll feel that going down curves. You might feel that going down steps. When you land with the leg that's shorter, you'll feel that knee pain, hip pain, even up into the back pain. You may never have experienced back pain before in your life, and it may just be sitting at your knee. But once we unravel everything, we're going to find that maybe it came from your back. The third reason is the muscle imbalance. The muscle imbalances are some muscles are pulling harder than others because some are stronger than others. So what has happened is your knee is now doesn't know how to move properly because some of the muscles that attach there are pulling harder and some of them can't make up for that amount that it's pulling. So you wind up with this inflammation going on at your knee when really it has nothing to do with your knee. Finally, we have the trigger points that develop throughout the entire leg. So from your hip to your back to your butt to your knee to your lower leg, we can find these snowball throughout. And depending on the amount of muscles that has been affected will show us how long this has been going on. But these can, they're silent, they are absolutely silent. You will not feel any pain in your muscles generally unless you push on them, and then you're going to jump off through the roof. But generally you'll just feel this nondescript knee pain. It just hurts. It doesn't necessarily have any period of time where it hurts. You could be sitting for a long period of time, you could be standing for a long period of time, but it just hurts. One of the things I want to say about this type of injury is people often say, well, I have bad genes, or I have bad hips, it's in my genes, or, something along those lines. There's no such thing as genetic influence on one side of the body and not the other. So if you are someone that's running and you have this knee pain, you're like, never mind, I'm done, my grandfather had bad knees, I'm going to have bad knees. And you only have it on one side, you are doing the exact same exercise on the other side also. So it's not something that you can say, oh yeah, well, it's just in my gene, I'm going to have a bad knee. No, if you're going to have bad knees, both of them are generally going to go bad. If it's something systemic or something genetic, it's going to go bad on both sides. When you have one-sided pain, that's a major red flag that there's some sort of muscle, there's some sort of joint, there's some sort of dysfunction that's fixable. We just have to be able to figure out what it is to fix it. So I have a couple offers for you today to take advantage of. The first one is if you email me at heather@totalperformancept.com. That's Heather at totalperformance, P as in Paul, T as in Tom.com. I will mail you a special report outlining these 4 causes and going into some more depth, some resources you can use to help you return to running or return to your sport, and just some general information about what's going on with you. When you email me, in the subject line, I want you to write which cause you think you have and why, and in the body, I want you to put why. What are your symptoms? What are you going through? What have you been told? Why do you think that one of those 4 reasons is what you have? And like I said, I will mail that report out to you ASAP, and you'll hear from me, and we'll kind of talk about some things that are going on. The second thing you can do is that if you're convinced that you have something, one of these 4 things that we can easily fix, you can call us at 215-997-9898. We have 2 locations in North Wales and Hatfield. One of our knee specialists will be able to get you in as soon as we can and get this solved. We deal with this all the time. People who come to see us have been told they cannot run anymore, they cannot work out anymore. That is the main reason people seek us out. So we have knee specialists that deal with this all the time. We'll be happy to get you in as soon as possible. The third offer that I have for you is the book, Run Better, Not Less. This is the book that I authored based on seeing so many patients who have been told not to run or not to increase their mileage or anything, or work out. This gives you at-home tips on how to solve many common pains that you feel while you're out running. It gives you common tips on strengthening, on what to do if you feel that pain. Instead of going 2, 3, 4, 5, 6 months without being treated or never running again, this book is the answer to help you get back your life. If you email me or if you call, again, it's Heather at totalperformancept.com or 215-997-9898. We will give you $5 off the cover price of the book, and we will send it out to you right away. Or if you are more tech savvy, you can go onto Amazon and purchase a copy to have sent to you right away. So again, it is the 3 offers that I wanted to make to you is sending me an email, Heather at totalperformancept.com. That's my own personal email. And just write in the subject line which of those 4 causes you think you have. And in the body, tell me why, and tell me your symptoms, tell me what's going on. The second is just call today, 215-997-9898 for an appointment, and we will get you right in and get you back on the road sooner than you possibly think. And finally, the book, Run Better, Not Less. If you call or email me, we will give you $5 off and get that out to you right away, or you can go into Amazon and purchase it. Living without running or living without working out and having that be something that was a part of you at one time is not living the life that you should be, and we can help you get back to that. So call today.